Okay, awesome. All right, well, welcome everybody. I'm so excited and thrilled that you decided to take time out of your day to listen in on this discussion. And if we don't know each other, I know a lot of new people have joined the group. My name is Molly Delbeck. I'm the creator of This Modern Midlife, and I really created that group to just create a safe space for women who are going through and navigating all the changes that midlife brings. And midlife starts a lot earlier than I ever thought in my mind. I had like this cognitive dissonance of like, I'm still in my mind in my 20s, and all of a sudden my body says otherwise. I'm like, okay, maybe I should do some research and figure out when does this actually happen. So for me, it was around the age of 39 where I noticed a notable difference of the way that I felt, my energy levels. And then my body started breaking down. I found myself in a neck brace with 7 herniated discs. And I went through a period of like probably 3 years of pain in my body, didn't know what was going on, felt completely blindsided by midlife. And then I find out I'm also in perimenopause. So I really feel like the two were connected. But since then, and this is the silver lining, I've learned to listen to my body. I've educated myself in what are some natural things that we can do to actually support ourselves through this process. Read all the books, got certified as a menopause coach, really to learn about what was going on in my own body. And now I've found just so much purpose in being able to like be a resource for other women like you that are like, you might be feeling the same way. Like, I don't know what to do. I feel blindsided too. And really it's kind of a labor of love for me because had I had the resources that I have now or the group that I've just created, I would have felt a lot more validated in that season versus, kind of shame and blame and like, what's wrong with me? Why can't I get it together? And why don't my workouts, render the same results that they used to? And why do I have to, you know, cut back on certain things that my body's now not agreeing with and just wanting to stay young, I guess. And having this idea of like, this is how it should be. But what I've found is that when you start to educate yourself and you get around other women that are going through the same things and you actually see that there are solutions to help support you through this journey, it can be really empowering. And you can, then wake up feeling energetic, feeling hopeful and like, hey, like I truly believe that midlife doesn't need to be a crisis. It's more of like an awakening of learning to listen to our bodies, learning to advocate for ourselves, and just taking a new approach at your life, your lifestyle, your relationships, your mindset, all the things. So, um, I was super excited because I have our first special guest, Abby Walsh. And Abby and I know each other from a previous venture, and we've just stayed in contact. She's just sweet as pie. She is actually one of the ones that reached out to me when my back had gone out and just gave me so much grace and like really genuinely wanted to know like what is going on? Like, are you okay? And so anyways, we've stayed in touch, and she went down this whole path of, you know, female health and hormones, and now she's, I'm going to let her kind of share. She's going to be able to share, what she's up to much better than I can right now. But everything that she was putting out there, I was like, I got to talk to Abby because we are like really on the same wavelength. And then we talked at length for like an hour, and everything she was hitting on, I was like, yes, yes. I'm like, will you come and talk to my group? And she's like, yes, for sure. So I know many of you submitted questions. I'm going to go over that. I'm going to let Abby introduce herself, tell you a little bit about what she does, and then I will make sure to dive into all the questions that you submitted. If you're on with us live right now, you can find your way down. At least it is down for me. There's a little chat box that will pop up. If you have any questions throughout this discussion, please put them in the chat box and I'll make sure that Abby can answer them before we hop off the call today. Because I want to make sure if you weren't able to submit questions in advance, but you're here on the call, I want to make sure that you get served with the questions that you have. So, I think that covers it for just some housekeeping stuff. Awesome. So, Abby, thank you again. I know you're a very busy lady and just taking time out of your day to share all the knowledge you got stuck up in your noggin is just
Absolutely.
it's gonna be awesome.
Um,
So, yeah, just take it
yeah,
away.
I'll take it away. So, I mean, I could talk for, I think, the next 3 months straight and never stop talking about hormone health and perimenopause and, how we as women need to advocate for ourselves. And there is hope and there's help out there. And so I've kind of made that my life mission. But I used to say I've been in the health and wellness field for 10 years, but I keep getting older and I've been working in health and wellness now for over 18 years. I started owning a boutique gym years ago, teaching group fitness and yoga. And it was really at that point in time when I was, young and at my quote peak health in my 20s that I noticed all of the women that I was working with who were coming to my group fitness classes and my yoga classes, they were in midlife and they would be coming and they'd be showing up to my studio, working out, 6 days a week, sometimes two classes. I was in school to get my master's in nutrition at that time, and they'd be eating clean and doing all the right things, but not getting the results that they should have been getting for the work they were putting in, right? It wasn't a lack of effort on their part, but they were really struggling and they were feeling defeated. And I made it a mission at that point in time where I was like, I need to learn more. I need to learn more about hormones and women's health and figure out how I can be an advocate for these women. And I started that journey well before I needed the help myself. And there was still more to learn at that time. So that started my journey. And then I got my master's in nutrition, like I shared with you. And I went on to specialize in women's health, hormone balance, and specifically weight loss during perimenopause and menopause. And so I created my own program. I worked with women one-on-one virtually all over the US. I started speaking, and through that process of really working with women on a natural health layer of nutrition, lifestyle, supplements, hormone testing, I learned a lot. And I got off my high horse of believing that everything could be done holistically. And I'm a very crunchy, holistic minded person. But, supplements can sometimes only take us so far. And there's nothing wrong with a little hormone replacement therapy. And hormone replacement therapy is great for some people, but other people don't want to do it. So, what are some herbal options that we could use in those circumstances? You would have never heard me talking about weight loss medications and GLP-1s 2 years ago, but the more I dove into the research and started being okay with being proven wrong and learning what really works for women, both clinically and also in the research, I became humbled over time and opened my mind to way more things. About 2 years ago, a friend of mine, Sarah Gibson, she's a physician associate, and we brought our businesses together to say, hey, Abby's doing all these natural health things, and Sarah can write prescriptions for hormone replacement therapy. We should bring this together so that all women have access to all the things that they need because I believe that we really to be whole and well can't have one without the other. Medications are wonderful and a great tool, but without supporting our body with good sleep and good solid nutrition and self-care, we really can't be our best selves. So we blended those things together, and now we co-run a company called Vitality Health Matrix together, where it's a really an integrative medicine practice for women to fill in all the gaps because I believe that there are a lot of incredible practitioners out there, OBGYNs who listen and care, and endocrinologists who are, very well versed in hormones, and PCPs who want to help. But the problem is that when we silo parts of the body and we go to all these different practitioners for all these different things, we're not all speaking the same language and working the same plan together. So that's what we do at Vitality Health Matrix is we really believe that we want our, person writing our prescriptions and the person recommending our supplements and the person telling us what to do for exercise and the person working with us for nutrition to all be talking together and working the same plan together. So that's what we do. And I've got to personally witness thousands and thousands of women now get their lives back. And that's what brings me joy every day is because I believe that this second half of our lives can be even better than the first half. And we don't have to believe the lies that we're just getting older or it's normal to gain weight or it's fine to have no sex drive and be exhausted and feel terrible every day. I believe you can all feel your best. And that starts with just being curious and not taking no for an answer. If you ask for help for a provider and you're told like, no, it's just in your head, you just need to eat less, you need to work out more, find a new provider because there are people out there who will listen to you and there is hope for healing. So there's so many things we're going to dive into today. I want to make sure that you get a chance to get your questions answered that you already submitted first, and I'll dive into all the golden nuggets that I've learned through my clinical experience. But why should you listen to me? I've been doing this for almost 20 years. I have a master's degree in nutrition, and I've helped thousands of women lose weight and balance their hormones. That's a little bit about me.
I love it. And it just makes me even more excited to have you talking to everybody because so many light bulbs just popped off for me where it's like it just resonates because I will never tell anyone in the group like there's a one size fits all. Like you should only do this. You should only take the supplements that I take. You should only, do cardio. You should only lift weights because and I know we talked about this in our conversation too, like based on how you metabolize food, where you're at in your health journey, if you're currently healing from something or whatever. Yeah, you just make so many good points. So awesome. So do you want to dive into some of the questions?
Yeah, let's dive in and we'll see where the conversation takes us.
Okay, awesome. So we'll start with this one. What is a good starting point for a hormone panel or labs? And does it matter where you're at in your cycle?
This is a great question, and it's a controversial one, which is my favorite thing to talk about. So, you're going to talk to lots of different providers, and they're going to have thoughts about where you should be in your cycle, and that's really because of the type of testing they do and the type of treatment plan they do. So, there's multiple different types of hormone tests that you can get. Some are salivary hormones, some are blood hormones. None of them are wrong. You just have to make sure that the provider that you're working with, they know what to do with the information that that test produces, right? There's even some hormone tests that are from dried urine, and we're looking at metabolites of hormones. So different hormone tests will give us different information, but all data is great. So in our practice, what we do is we believe really at a core philosophy of science that there's five main hormone imbalances that affect women in perimenopause and are the culprit for why we're holding on to weight and not feeling our best. So those hormone imbalances that we look at are the thyroid function, sex hormones. We're looking at cortisol, which is our stress hormone, insulin, which is our blood sugar balancing hormone, and vitamin D, which is a vitamin, but it really acts more like a hormone regulator in the body. So those are the five kind of buckets that we test, but then there's lots of markers within each of those buckets that we also test. So for example, thyroid. A lot of times we'll go to our traditional medicine doctor, to our PCP, and we'll say like, I'm so tired. I'm not waking up in the morning. I have no energy by 3 p.m. Or I work out and I feel like I crashed afterwards. I'm exhausted. I'm not losing weight. I think there's something wrong with my thyroid. And if you're lucky, maybe they're going to test one marker for your thyroid. They're going to test TSH, which is thyroid stimulating hormone. And that's a screening marker for your thyroid. And it's just going to tell us how hard your thyroid's working right now. But it's not going to tell us how well your thyroid is converting inactive thyroid hormone to active thyroid hormone, which is the whole basis at which you're going to be feeling well or not feeling well. So whenever we look at a marker, it's not just about testing that hormone, but testing all the markers that affect it. So for thyroid, we're looking at your TSH, that screening marker, but we're also looking at free T3, which is active thyroid hormone, and free T4, which is inactive thyroid hormone, so we can see how that's converting and where the problem is so we can heal it at a root cause level. We also look at thyroid antibodies. Is there an autoimmune portion of why our thyroid isn't working well? That tells us about inflammation in our thyroid. So that's just one example of how we deep dive into that. So in our practice, in those five hormone imbalances, we test 12 different markers. So all those thyroid markers I told you about, if you're writing this down, we test estradiol, which is estrogen. We test progesterone. We test testosterone, DHEA. Those are the four markers that make up sex hormones that we test. Cortisol is the stress hormone that we talked about. We test fasting insulin and hemoglobin A1C for your insulin and blood sugar balancing levels. And then we look at your vitamin D3 levels. That's hydroxy 125. So that's what we look at when we're testing all hormones. And that's our starting point to say not just what's going on with our sex hormones, but from a metabolic standpoint, all our hormones work together. So I like to explain hormone balance like this. Our hormones work in a little bit of a hierarchy. And at the top of the food chain is insulin and cortisol, the blood sugar balancing hormone and the stress hormone. They work together. And if those two are not balanced, no matter what we do down the food chain, everything else is going to fall out of balance because cortisol is a precursor hormone for our sex hormones. Okay. So if we don't have cortisol and insulin balanced first, we're not going to be able to keep thyroid hormone regulated and sex hormones regulated as well. So that's why it's really important that we look at all of them together and we're working at a root cause level. I'm going to go on a tangent because this is all really good education for you as we talk about it. But when we're talking about all those hormones too and testing and what matters, it's important to know that as we shift into, our stage of premenopause, right, which is all of our like fertile years, into perimenopause when things become more erratic with our hormones, during that shift from perimenopause to when we officially stop menstruating, menopause is 1 day, ladies. Most people don't realize that, but menopause is 1 day in time, and then we're postmenopausal after that. So during that perimenopausal time, when hormones are erratic, your body is doing this. Our ovaries are what was responsible for creating our sex hormones before, and they're puttering out. As we're running out of eggs, we're not ovulating anymore, we're not having consistent periods anymore, we're puttering out with our production from our ovaries, and our adrenal glands take over sex hormone production into menopause and postmenopause. So, what our adrenals are responsible for is creating our stress hormone, cortisol. So think about that. If you're already super stressed and your adrenals are already working really hard, and then our ovaries are starting to fail us and our adrenals need to take over sex hormone production, if we're already too stressed, we don't have much energy juice in the tank to make those sex hormones. So we're going to suffer more. Do you see how that works? That's why it's important to work from the top of the food chain down when we're balancing out our hormones. Did that answer that question?
That makes so much sense because I remember my mom, and I don't think she would mind me sharing, but like when she was going through kind of the end of her perimenopause, like really getting up to that. And I had learned too that the average age of menopause is age 51. And anyway, so I don't remember how old she was when she was going through that, but her adrenal glands were absolutely shot. And she had, bags under her eyes, and she was just so stressed out. And now that you're explaining it that way, it makes so much sense that that's why that was happening. And then, just like so many women went to her regular doctor and felt like a number and wasn't listened to and finally became an advocate for herself, which I'm so happy that she did because that's really what got me so interested in hormone health. Because I'm like, I don't want to go through that. I
Right,
want to do anything I
right.
can. So yeah,
Yeah.
that is a great way to explain it. So, and the fact that you're going through 12 different hormone markers and like actually relating them to the whole picture versus, your point on not, compartmentalizing each separate issue, but like let's bring them all together and talk about the full picture.
Yeah.
So this was kind of a question that was related to that question from the same person. What are the common myths accepted as truths in the health industry? And
Oh,
we
perfect.
probably, that's pretty broad, but
Yeah, that that one's broad, but I'm gonna come back to it real quick because I was just reading that last question about the hormone markers, and I want to add to this. You asked about if it's important where you're at in your cycle.
oh,
And
yes.
so a lot of people who test hormones will say we should test at progesterone's peak. And progesterone's peak in our cycle is between day 19 and 21 in your cycle for most people. In our practice, the way that we work is we actually don't really care what your progesterone level is or what your estrogen level is. What we care is about the ratio between the two, because that's when symptoms are going to be there for you. If estrogen's too high at some point in your cycle and progesterone's too low, that's what we care about is the ratio of those two hormones. So we can look at that ratio at any point in your cycle and know whether it's too high or too low or what we need to do to get that back in balance. If you're working with a practitioner who doesn't work off of ratios, they might want you to test at that peak time in your cycle so that they can know if you're ovulating, how strong that ovulation is, if we're getting enough progesterone that way.
That makes a lot of sense. And
Yeah.
it makes it easier for us too, because we can go in and get tested
Right.
whenever it
And
works.
I always say this might sound a little catty of me to say, but I'll say it anyways, because I think there's not enough screening markers for like finding a great practitioner. And if you're working with somebody who wants you to just time it out to be a certain time in your cycle, they're relying on ovulation to tell them the story about your hormones. And for most women in perimenopause, like we're not ovulating consistently. Like we might go 60 days without a period and then 45 days without a period, and it's all over the place. So we don't really want to rely on ovulation as the point to getting that balance to feeling better. We want to be able to feel good all month long. Does that
Yeah.
make sense?
Yeah. And that was the biggest indicator for me. It was like I would get my period at 20 days and then I wouldn't get it again for 30. And I'm like, what is going on? And I've always been clockwork. So I'm like,
Yeah.
pretty good indication. So
Perfect. So we
thinking
got
of that
back to the
question.
myth question
Yeah.
now a little bit. So myths that are accepted as truth in the health industry. There's so many of these. If there's any in particular, if you're on here live and you ask that question, feel free to like pop some specifics to direct me in the chat. But one myth that I hear all the time is that hormones don't matter whenever you ask for hormone testing. That you'll hear, oh, your hormones fluctuate every single day of the month, so there's no point in testing your hormones.
Mm,
There's absolutely a point in testing your hormones because it's not just about sex hormones. Estrogen and progesterone fluctuate all the time, but your thyroid hormone, your vitamin D, all of these other things that we're looking at, they do not fluctuate every day and they all play a role in the puzzle. And also, like we talked about with those ratios, we can look at those ratios at any point in the month and still get a good read on what's going on in your body. We also don't want to use hormone testing as the end all be all, which is another thing. So you might find, okay, there's these practitioners that say, don't test your hormones. And then other practitioners that say, like, my hormone test is the only way to go. We only want to do the Dutch test and see your metabolites, or we only want to do saliva testing. Any absolutes in the health industry we should run away from because there's not a one size fits all answer for almost anything when it comes to health because we're also biologically different. So, what I think is really important is to take hormone testing and symptoms together and make a plan because
mhm,
sometimes you might look like you're in a quote normal range but you don't feel your best, so your normal and my normal baseline levels might look way different, right? So we've got to look at symptoms and labs together. Another myth I hear all the time, and everyone who even works in weight loss likes to say this, but it's not true. We don't just want to eat less and work out more. Less
mhm,
is not more when it comes to food. We need to be nourished. And whenever we're in this critical stage of life where we're starting to lose hormone production, the worst thing that we could do is eat less because we downregulate from a metabolic perspective every year of our life. It's unfortunate, but it's true because we lose muscle mass. So we could look at me today, the exact number of calories I eat, the exact amount I weigh, and in 5 years, if I ate the same thing I ate today every day for the next 5 years, I'd still gain 10 pounds because metabolically, I would lose muscle mass over time, research tells me, right? So it's really important that we don't start eating less. We want to preserve muscle mass by eating enough,
mm,
right? We want to make
mhm.
sure we're getting enough nutrients in our diet to create, metabolize, and get rid of excess hormones. So being nourished is super important. So don't believe that eat less, work out more. We really need to start listening to our body and creating custom plans based off of where we're at in life.
I love that. And that kind of reminds me of like when we were talking the other day and you were talking about how, one person might, metabolize carbs differently.
Mm.
So, the whole craze, as I'm learning in my certification, it's like, this is how much protein you should be having. And I was telling Abby, I started adding all of this protein. I've got cottage cheese and I've got, everything I wanted to be like protein rich. And then I started to kind of like not, I could tell I wasn't metabolizing it very well. And then I kind of, weaned off a little bit and I went back to, introducing more carbs and like kind of how I know my body metabolizes and everything evened out. So, even though they say this is the general range of how much protein you should be having, like listen to your body because it might not work for you. And that's what I noticed about me. It's like, okay, chill out on the cottage cheese, Molly. So,
Yeah, that's so good. While we're talking about nutrition, I'm just gonna hop to one of these questions that dug a little bit deeper in that
yeah.
area, and it was just asking about like what should we do in regards to nutrition, like as we age and factoring in our hormones. And so, this kind of just plays into there's no one size fits all. So again, like if you are going to, sign up for some program you see online or you buy a book or whatever that might be, there's no one plan that's going to work for everybody. So if the plan is intermittent fasting, like I run away from things like that unless intermittent fasting works really well for you. Or like if it's like everybody should do the keto diet, everybody should not do the keto diet. Some of us do really well with that, some of us don't. So
Mhm.
what I recommend when it comes to nutrition at this stage of life is that there are layers to our health journey, right? So I never want to minimize starting with like right where you are. And we don't need all the fancy schmancy stuff until we get the baseline stuff down a little bit, right? And so this is one teaching that like it was a term I kind of coined and made up in my own life when I started working with clients, and I call it home base. Okay. Home base is four things that we need to do. They're four main pillars of health when it comes to nutrition, and they never go out of style because they're not a fad. And that is we need to drink water, eat vegetables, move our body, and sleep, right? I say if we do not maximize these four foundational pillars of nutrition, we don't need to get sexy into calorie counting and macro counting and doing our DNA testing, which I love and I'll talk to you about. But we can do these baseline things first. So like, are we drinking enough water? Because hydration is really important for our hormone health. Are we getting at least 7 hours of sleep a night? If we sleep less than 7 hours a night, research shows that our insulin and cortisol levels are going to be higher. So there's one thing we can do for our hormones just right there. Eating more vegetables. Vegetables are rich in phytonutrients, which are going to support all of your metabolic pathways, your methylation, your detox, all the sexy fun words we could talk about. But getting enough antioxidants in is going to help your skin health, all the things that we're working on. Vegetables take up more space on your plate. They're literally more volume. So we can eat more for less calories. They contain more fiber, which is going to naturally increase our GLP-1. All of these things are like not new news or sexy, but I'm telling you, they're the things that make the biggest difference for women. So eating at least half our plate vegetables, I tell women to shoot for. If we're not there yet, don't worry about sexier tools. And then we talked about sleep, we talked about water, movement. Do what makes your body feel good. Like there's not one exercise that everybody needs to do. But if you're waking up at 5 a.m. to go to Orange Theory or you're running and training for a marathon and you feel exhausted, if your body's telling you no, well, maybe that's not the best for you during a healing stage right now, where we need to support our body and kind of heal our adrenals and our cortisol response a little bit more. But that doesn't mean that you can't ever do that again in your life. I say move more instead of focusing on like what specific type of exercise. So that's home base. That's the non-sexy nutrition advice that I can give you that'll never go out of style, and we want to maximize that on. But I like to say once we have that stuff down, and we're doing those are like second nature to us. It's not like a goal we're striving for anymore, but it just becomes part of life that we're drinking enough water, we're eating our vegetables, we're sleeping, we're moving our body. Well, then we can stack on top of that and learn more cool things about our body. And that's where I think DNA testing comes in. So part of our practice, it's not something every client has to do, but one thing we do offer is DNA testing. I think DNA testing is really cool when it comes to personalizing your health and nutrition on a deeper level, because how do we get any more personalized than your own DNA? There's nobody just like you. So just like Molly was talking about in an example of like eating more protein, there are genetic markers that say some people benefit from higher protein levels, but some people don't. I personally, in my DNA, I don't benefit from a low carb diet. So whenever I eat low carb, I typically don't lose weight and I don't feel good. I lose all my energy. My thyroid starts to suffer. I'm waking up in the middle of the night and I'm not sleeping as well. So when we look at our DNA, we can see how our body responds to carbs, proteins, fats. When we look at detox pathways, methylation and hormone balance, what nutrients does our body have a propensity to be deficient in? And we can supplement smarter, right? But those are all additional fun sexy tools that help you with lifelong wellness and longevity. It doesn't have to be where we start today.
Yeah, that's next on my list. I want to get a DNA test. That's
Yay.
really fun. Brittany just popped in and asked a question. She said, "What do you recommend for testosterone for women? Cream shots versus pellets?" And separately, so this is another question, GLP-1 supplementation in perimenopause.
Yes. So, testosterone is a really controversial subject in the hormone health space as well. I hope that that changes over time from a government standpoint in the FDA. But right now, testosterone is viewed as a controlled substance. So, in order to actually prescribe testosterone, you need to be able to not only be able to prescribe like prescriptions, write prescriptions, but you have to have an additional license to prescribe controlled substances. So it's a little controversial, and then that means that people kind of tiptoe around doing different things, going to different clinics to get things done. And it gets a little bit ugly out there in that space. I won't lie to you. I'm not a super big fan of pellets. I'm not a super big fan of injections. That's just my own clinical opinion. And that's because those make your testosterone go high fast, stay high, and then slowly taper off over time. So, women who already are struggling with maybe some symptoms of estrogen dominance, for example, like estrogen dominance symptoms would be like if we feel like bloated and fluid filled all the time, our breasts feel like they're getting bigger, we have like heavier bleeding, clotting, uterine fibroids, fibrocytic breast tissue. All of those things are symptoms of estrogen dominance in the body. If we're getting high levels of testosterone at the same time, that can push those symptoms to be even worse for women. So we might get a benefit from like the libido department, and energy department, but then we're struggling in other ways. So personally, for me, I think that testosterone is wonderful. I hope in time, through lots of research that I've done and lots of providers that I work with, I hope that we have an option soon, someday in the next decade, where just like we have an estrogen patch that we can do for bioidentical hormone replacement therapy, that we have a low dose testosterone patch that's specific to women. Because right now we're dealing with like super high doses of testosterone. So if I were going on testosterone therapy, for me, it would be like a combination cream or gel that I would say would be best, mixed with other hormones. But for most women, we can honestly start with progesterone and estrogen. And when we balance those out well, we often get a rise in testosterone or we get like a good balance. We don't need our testosterone as women to be like sky high. That's not super great for us either. And we can get other symptoms that we don't like. And that's when you start seeing like facial hair and things that we would not like to have happening to the body. So my vote would be a cream or a gel. Personally, and you want something that we can control and find that perfect spot for you instead of doing super high doses at one time. Does that answer your question? I believe you were on here live.
Yeah, let us know, Brittany. And then it looks like Lisa just shared in the chat. I don't know if you can read it.
Do you care if I read this out
No,
loud?
you go for it.
Okay. I've had thyroid issues the last few years, just recently had blood draws. My TPO is high 203, TSH high 5.2, T3 and T4 are normal. Insulin levels, vitamin D, estradiol are all in range. Waiting on my cortisol results were previously in range. What would you look at to understand what's causing the spike in TPO and TSH? So great question. I'm happy to kind of elaborate on your labs a little bit. One thing I'll say that I don't have the values here, but you shared are in range. So I want to talk just about what in range means first. So all lab work, when it's done, unless you are working with a provider who has like physically changed the ranges on the lab reports, in range means on average, all the people who get their labs tested, this is the range of healthy. Now, the people who typically get their labs done are the people who don't feel well, right? So we're taking our average, quote, normal range off of people who aren't well instead of people who feel their best. So there's a difference between normal range, which is written on your lab report, and optimal ranges, which is when experts like myself who work with thousands of women, every year, we're looking at where do women feel their best. Those are where we want our optimal ranges to be. And then we specify even further personally, how are their symptoms? Are their symptoms managed too within that? And we find that women's symptoms are, non-existent for the most part when we're in these higher optimal ranges. So, for example, you had vitamin D in range. So, in range in conventional medicine is above 33. Okay. Where we say minimum is for women that we work with is 60. So that just gives you one example of how, why do we say 60? Well, because in all research studies, women who are metabolically healthy and are able to lose weight, their vitamin D is above 60. So we want all our clients' vitamin D to be above 60 in order for them to maintain a healthy weight or be able to lose weight and produce the hormones they need to in their body, right? So I just say that to you, Lisa, so that if you're working with somebody who's working with optimal range is awesome, but otherwise we might want to revisit some of those levels that are quote in range and make sure that they're all good too. Because like I said, those 5 hormone imbalances that we look at, we want them all working together. So we're still not going to feel our best if like one's optimized or two's optimized. We want all 5 to be optimized and working together. So in your situation, what's causing a spike in TPO and TSH? I don't know if you've been like treated for thyroid issues before and they got normalized and now it's high. But whenever TPO is elevated, that is our thyroid peroxidase antibodies. And that's saying basically your body's attacking your thyroid. It's saying there's inflammation here and we want to resolve it. So your body creates antibodies against your thyroid, right? So we want to reduce thyroid antibodies to reduce symptoms. When thyroid antibodies are low or non-existent, we're going to have less symptoms and less inflammation. How do we reduce thyroid antibodies? Well, we want to make sure we get the thyroid working well in general, because if it's not regulated and optimized, well, your body's going to keep being inflamed because it has to work harder. Okay. So we want to look at that free T3 and free T4. I know you said they're in range, but are they optimal? That's what we want to look at, because we want to make sure that your body has enough pull of free T4 to convert into active free T3 where you feel your best. I would say that it's not optimized if your TSH is elevated still. We want your TSH in our practice to be 1.8 to 1, and yours is at 5.2. So for you there, I would say if you're not already on, B vitamins, methylated B vitamins are going to be supportive. If you're not taking a multivitamin, multi-mineral supplement, selenium helps reduce thyroid antibodies. But in our practice, we use multiple tools. So I might have somebody on Armour thyroid or NP thyroid, which is a natural desiccated thyroid hormone medication. That's not like synthetic, like Synthroid, but it comes from desiccated pig thyroid. I personally take Armour thyroid. It changed my life because it contains active thyroid hormone and inactive thyroid hormone, and that helped resolve my symptoms and bring down my TSH, in addition to taking vitamins and minerals. Another thing that we do in our practice is we prescribe low dose naltrexone. That will highly reduce thyroid antibodies as well. So we want to get inflammation down in your body. Inflammation can come down in your body via food as well, foods that are causing inflammation, toxins that you're exposed to. There's lots of things that create inflammation in the body. If we can get inflammation down, you're going to feel better. I hope that that answers your questions, but mainly we want to look at optimal ranges is my answer for that whole question.
I love it. At least I got a whole like doctor visit today. I love it. And we're recording this too, so if you need to go back and and listen, that's okay. So I know you covered some of these. Do you have the questions in front of you? Because I know you covered a
Yep, I
few of
covered some of these.
them.
Let's look through. We talked about testing. Oh, curious about HRT. We talked about testosterone, but we could talk about a little bit more about HRT in general too. How do we know normal versus functional levels? I hope I answered that for you guys. Natural ways to increase GLP-1 we could talk about, and we could talk about GLP-1s in general there too. Um, so let's start with natural ways to increase GLP-1, and I'll talk about some peptide therapy as well. So whenever we're talking about GLP-1, that's glucagon-like peptide 1. That's a naturally occurring hormone in your body. And most people think that, oh, people taking GLP-1 medications, that's like, synthetic. No, it's something that your body's already producing right now. All of us have GLP-1 in our system. Now, GLP-1 is controlling our hunger, our satiety, how we store fat, how energetic we feel, so many things it's regulating in our body. Now, whenever we are eating, naturally, we can increase our GLP-1 too. There's a couple ways to do that. One is fiber, another is protein. Those are great ways to increase GLP-1 because we're regulating fullness and satiety with protein. Fiber does the same thing. Also, the way that we can increase GLP-1 is through fermentation in the gut, which is why fiber is important. So as fiber breaks down in the gut, we're talking about prebiotics and probiotics, the food in our gut that our body breaks down bacteria and it creates food for bacteria. That's prebiotics versus probiotics. And in that, that naturally increases our GLP-1 too. So focusing on protein and fiber can really help with that. Building muscle can really help increase GLP-1. There's also certain probiotics that do so. One that I created actually for our company, we call it GLP-1 Probio Activate, but this product, the combination of probiotics in here is what increases GLP-1. One big one in it is Akkermansia. Akkermansia is a bacteria species in the gut that is more highly populated when people can maintain a healthy BMI. So if we can get the whole microbiome to be more looking like somebody who maintains a healthy weight, you are going to lose more weight and be able to maintain a healthier weight too, because those bacteria strains naturally increase GLP-1, which is pretty cool. So that's some natural things that you can do. When we're talking about taking GLP-1s as well, there's a lot of different peptides out there. I don't know how familiar you all are with like peptide therapies in general, but injectable peptides like semaglutide, tirzepatide, what we kind of hear on the market when we're hearing name brands, we hear Ozempic, Zepbound, Wegovy, all of those drug names. They are really, really cool medications. And I, as a holistic person, like I told you, I would have never thought that I would ever try any of these peptide therapies myself. But I can tell you that there are really incredible, safe, and healthy ways that you can use them. So if you just go to your PCP and you qualify for Ozempic because your BMI is over 30 and they give you a dosing schedule to follow, you're going to take super high doses of that drug by following that dosing schedule. What we do in our practice is we microdose, meaning we give a teeny tiny baby dose of medication to actually work on a root cause level in the body. So if we're weight loss resistant, I like to say that first, what did we all learn today? What are those top dog hormones? Insulin and cortisol, right? Insulin is one of them that's really important when it comes to fat storage in the body. So I want you to think about this. Everything that we eat turns into glucose. Glucose is blood sugar. Whenever there's sugar in the bloodstream, glucose is high. Your body says, we need to get blood sugar down. Insulin comes into play to lower blood sugar levels, okay? Now, the way that we do that is insulin shuttles sugar, glucose into the cell for energy. So if you are fatigued right now, you are tired no matter what you do, one of the things people don't often think about is I'm probably a little bit insulin resistant because sugar energy isn't getting into my cell, right? That's insulin resistance. I want you to think about there's a key and there's a lock, and the lock cannot be unlocked, right? And so what we do with a GLP-1 is we just unlock the cell, and now sugar can get into the cell and we have energy again, and we're able to burn fat instead of store fat. We heal those insulin receptors at a root cause level. So now we're not using a medication as like a quick fix or a band-aid approach. We're saying, can we use a tiny little baby dose to get energy into the cell so we feel energetic? We can start to get the needle on the scale moving while we heal those underlying imbalances when it comes to your hormones, so that you can not only continue to lose weight, but you can keep weight off for the long term, right? So that's one way that we use GLP-1s in our practice. The other thing I'll share with you is there's a lot of research coming out when it comes to microdosing that there's benefits beyond weight loss. Some of those are, for inflammation in the body. Whenever we increase GLP-1, we reduce inflammation. I'll give you an example for myself because I'm not afraid to share it with you guys, that I microdose semaglutide, a GLP-1. I never needed it for weight loss. I've been at a healthy weight for a while. And for me, I didn't have my thyroid optimized. I was feeling very sluggish and inflamed still. When I started doing a tiny little baby dose of semaglutide, not at a weight loss level, now my fingers don't feel swollen when I wake up. I had a lot of back pain. My back pain went away. My skin health improved and is glowing and shining, because when our insulin levels are up, we actually have some inflammation that happens in the skin as well through some chemical processes that you don't care what the names of them are. I could get geeky with you, but there's so many benefits for reducing inflammation in the body when it comes to GLP-1. So even like Lisa's circumstance here, where we're looking at elevated thyroid antibodies, any autoimmune issues can actually be at the root level. We're talking about inflammation. So if we can get inflammation down in the body, we're going to feel better. And microdosing a peptide therapy like a GLP-1 can be really beneficial for that. Does that answer those GLP-1 questions for you guys? Do you have any other questions specific to that?
Yeah, if you're live, you guys can chime in the chat, but it rings true for me. And whatever you said about getting the glowing skin, I'm I'm in for that. I'm
Yeah.
I was just telling a friend the other day, I'm like, I'm the healthiest I've been in years, and my skin's not showing it. And that's just been, years of dealing with acne and things like that. So I'm excited. So for those of you who are listening in on the call, I'm actually going through Abby's um, practice, and I actually just got my labs done yesterday. Should be getting that soon. And we can talk a little bit more about like what that looks like and if you guys want to check out what she does and all of that. But let's make sure we're through the rest of the questions. I want to make sure that
I think I hit them
everybody,
all
did you?
that,
Okay.
that you
Oh,
sent in
okay.
advance.
Yeah, because we talked about myths and facts, GLP-1s, perfect.
We can talk about HRT a little bit
Okay,
before we're
yeah.
done. So, there are lots of different types of hormone replacement therapy out there. And what I want to get across today is that the most important thing to think about is you want bioidentical hormone replacement therapy. So, if you ever, have heard, about the Women's Health Initiative and studies that showed that hormone replacement therapy increases cancer risk, all of that, one, was faulty research if you go and look at it all at the bottom line level, but it was on synthetic hormones, meaning hormones that are not what your body naturally produces, and that increases inflammation in the body and can increase your risks of breast cancer and other types of cancer. Now, whenever it's the hormone that your body knows what to do with, it's bioidentical, it's exactly the same, that does not carry the same risk at all. And progesterone specifically is incredibly anti-cancer. It's cancer protective in the body. What is not good in the body is when estrogen levels are too high and they're unopposed, right? So when progesterone comes in, it's actually super protective in the body, and that's what we want to do. So bioidentical progesterone is one of the safest things that we can do. A lot of providers will even provide that for women who have had breast cancer before. Now that is going to be provider specific. You always want to work with your oncologist if that's the case for you. But my point is progesterone therapy is very, very safe in the body. Even estrogen is very safe whenever it's monitored and we have progesterone with it. If you have a uterus, you need progesterone. That's another take home when it comes to hormone replacement therapy. You never want to take estrogen on its own. If you have a uterus, we protect the uterine lining from endometrial cancer by having progesterone alongside of it. So bioidentical hormone replacement therapy. Now, you can get bioidentical hormone replacement therapy sent to a local pharmacy through the form of like an estrogen patch, the Dottie patch, if you've heard of that, oral micronized progesterone. We take those together if we have a uterus, like I said. And there's also another one that's often prescribed, estrace, which is an estrogen vaginal cream. Now, even if you had breast cancer, you can use vaginal estrogen because it stays localized. It does not go through the body. Okay. So those are really important take homes for everybody when it comes to hormone replacement therapy. The other thing that you can do outside of being sent to a local pharmacy is you can do compounded hormone replacement therapy, which basically just means at another pharmacy, they put it together exactly how you need it. So for me, I use compounded progesterone cream. And so that is the exact dose that I need in a cream that I do a little click before bed and I rub it on my forearms, right? So that is compounded hormone replacement therapy, or they can compound it together with estrogen and progesterone together in a cream. So that's from a compounding pharmacy. There's lots of different ways to approach hormone replacement therapy, but the most important thing to know is that you want to work with a provider that you trust who understands how to take symptoms and labs and put those together to find a personalized plan for you, which again is why I'm just not as much of a fan of like the hyper doses of things. We want just hormone replacement therapy, we don't need to be at the same levels we were when we were in our 20s. We just need to be at a consistent level to feel well and not have symptoms where we are now, right? So that's a little bit about hormone replacement therapy. I recommend you always get your hormones tested and you're working with a provider, but there also are some over-the-counter options that you can use too. Our company actually created two different creams that are over the counter. I'll show them to you so you know what they look like. But we have a progesterone cream and a combination estrogen, progesterone, DHEA cream that are both over the counter. So these are lower doses than you would get in a prescription so that it's safe. But we market these more as like a cosmetic cream. So it's a higher cream to hormone ratio so that we can use them safely at home. But I still recommend you get your hormones tested, even if you do hormone testing through our company, like we'll talk about, you can still get that done and over the counter buy hormone creams that you know what level to use yourself. So those are options for you. I'll say for almost anybody, unless you've had a progesterone positive cancer in your life, taking a over-the-counter progesterone cream, if you're in that like just starting perimenopause stage or like you're in the beginning of noticing symptoms around your cycle, this can help with like anxiety, sleeping through the night, all those things that we start to notice in the beginning, or an irregular cycle, heavy bleeding. A little touch of progesterone can change a woman's life. So it's super safe. You can get some of those over the counter, but those are kind of the different levels of hormone therapy. Over the counter hormone creams that you can buy, compounded hormone creams that are more specific to the local pharmacy, and then testosterone, its own beast that we talked about. Does that answer HRT questions?
Well, I love that you have a cream for progesterone too. I was actually prescribed progesterone, but at oral. For some reason, I get weird about taking oral
Hmm.
medications. And the creams, it just seems like it's you can monitor it better, right?
Yeah.
Based on how
Yeah.
you feel. So I love that that's an option. And you can do an over-the-counter one. Okay, awesome. Well, I know we're reaching the top of the hour soon, so I want to make sure that I'm mindful of your time and everyone else. I think this would be a good last question. Does she see people privately and does she accept health insurance? So maybe share with everybody, like, what does it look like to work with you? I can share a little bit about my experience so far. And if they want to work with you, how does it work? What does that look like?
Yeah, absolutely. So I wish that we could take insurance when it comes to like a visit perspective, but we work outside of the traditional medical system on purpose. And that's so that we can spend the time necessary with patients. Whenever we accept insurance, we are then required to follow all those guidelines. And that means that they get to decide how long we get to meet with you for 15 minutes and what's going to be covered. And we know what it actually takes for women to feel good and get results. And we don't want to be put in that box. So we do participate with like health savings accounts can be used with us. We're a telemedicine practice. So if you have an HSA or FSA account, you can use those with our practice. We can submit labs to private insurance as well. So if you know that you have good insurance coverage for lab work, we can send your labs to the private insurance to work with them that way. But that's the only real capacity that we can work with private insurance. We do give patients super bills all the time. So if you've heard of that, that is basically like an itemized receipt of services that you paid for through us. And some insurance companies will let you submit that if you have out of network coverage and give you a little kickback. Usually not the whole amount, but sometimes they'll pay something towards it. And we're happy to provide that for you if you want. So that's kind of the insurance question. We try to make things as accessible as possible for patients. So, one of the ways that a lot of hormone labs are not covered by some insurance companies, or if you don't have good lab work coverage, sometimes like that 12 panel hormone panel that I was talking to you about, I've seen it cost clients $0 and I've seen it cost them $1,500 depending on their insurance coverage. So we have partnerships with labs like Quest, and Quest Labs, since we do so many labs for patients, gives us like a locked in cash price. So that's a great option for patients. We'll do prepaid lab slips for them for $250 and they can get their labs run that way and not have to worry about what their insurance will pay for or not pay for. So that's an option. But all clients, when they come in to work with us on any level, we start with what we call a personalized health blueprint. So, just like we talked about today, where I don't believe there's a one size fits all supplement or medication for any of you. So the way that we really get to the root of what's going on in your body is we give you a platform to share your story and tell us what's going on with you, to explore your health history, to see what symptoms you're having, and test your labs. So we do your lab work, we do those 12 hormones, we spend an hour with one of our integrative medicine providers, which means they are somebody that is traditional medicine trained, so they're licensed, but they also have functional medicine training. So they can talk to you about nutrition and lifestyle and supplements and bioidentical hormone replacement therapy and GLP-1s and all the things that we do. So that package is your personalized health blueprint. That's $500 when a new patient comes in, and that includes your lab review, your personalized plan of exactly what supplements, medications that we would recommend for you, and meeting with one of our integrated providers for an hour. We give you a lab slip to run through your private insurance. And if you don't want to run it through your private insurance, like I said, you can get one of our lab slips for Quest or LabCorp. So that is the package I recommend that people start with, and that's what Molly is doing with us to start too. But one thing I wanted to offer you guys, because I love when I get to talk to people, I actually called my business partner Sarah right before this, and I was like, "Listen, I want to do something special for these ladies because I want them to not have any barriers for answers." And so we decided that any of you who are on here live or anybody in the group who watches this replay, for the next 24 hours, we are going to give you the prepaid lab slip if you do that $500 blueprint, because I don't want any of you to be surprised by a bill from your insurance. So we are going to give that to you included in your $500 so that you can get your labs done, you can get a plan, you can get answers. And then from there, you get to decide. You can order, creams off of our site, you can order supplements, you can, go that route and kind of DIY it. Or if you want to, get a medical package and continue working with us in one of our programs, you can choose to do that as well.
Wow, that's a surprise. I didn't know you were
Yeah,
coming
Molly
out
didn't
with
even
that.
know I was going to do that for you guys.
That's
But
amazing because yeah, I can just the thing is like in a way, and I want to stay positive, but in a way, our our healthcare system is failing women in midlife. And what I learned through my certification is that even OBGYNs and providers that are working with women are getting like 3 hours of training on menopause, perimenopause, and all of that. And it's just, it's unfortunate, but everything that I've done to learn the most about my hormones, I've had to invest in it, whether it was the Dutch test or, seeing functional providers. A lot of times your insurance doesn't cover that. So I think it's a mindset shift where it's like, okay, I've got to invest now for this second half of my life. Like that's where I had to come to, where it's like it's worth it to me to understand what's going on in my body, to know what's going to help support me and, move forward every day feeling better. So I think that's a really, really awesome deal. Thank you for doing that for us. And Abby actually gave me, Melissa says, thank you. I need to hop to a work meeting. Thanks for hopping on, Melissa. No worries. I will pop in the link. Abby actually gave me a special link for our group. I will pop that into the chat here before we log off. And then what I will do, let's see, where did I keep that now? Um, is I'll put it in the group with the replay of this call so that everybody has access to it. So you can check it out, decide if it's right for you. I'm super excited about it because I'm like, I was due for my labs, so I'm like, okay, I'm gonna go through you. I love that you do everything virtually. I don't have to go anywhere. So there's the link if you guys want to check out. This is her blueprint. All of those, 12 hormone markers that she was talking about. That's what I got tested for. I think they took like 6 vials of blood. It was in and out, easy, easy peasy. So Lisa says, so helpful. Thank you, Abby and Molly.
absolutely.
Awesome. Well, I want to thank you so much, Abby, for taking your time, providing that discount. So I'm going to let everybody know that that just goes 24 hours. So hopefully everybody will catch the replay and get rolling. So, and I can't wait to get my results back
I
and
know. I
get,
can't wait. Molly
get
can share with you guys what's going on with her and all the details. But
Yes, I'm going to keep everybody updated. I'll be the guinea pig. Jennifer says this is so well worth the time. Thanks for the information.
you're welcome,
Told you
Jennifer.
guys, Abby's like got so much knowledge coming out of her brain. I'm like, oh, I just want to like sit in your pocket for the day and just listen to everything. It's awesome. So thank you so much for your time, Abby. I appreciate it. If you
Absolutely.
hopped on live, kudos to you for investing in your time and learning all about this stuff. And yeah, we'll see you guys soon. Thanks again, Abby.
See you guys.
All right, we'll see ya.